But I'm saying, look, I got 15 years left. I don't.
15 years what, on the Earth? On the Earth? What is your,
yeah, on the
does
Earth.
your birth certificate have an expiration date? How do you know it's 15 years?
If I get to 85, right, I consider it lucky if I get to 85.
You know what? It depends. Your age will be determined by what Oracle and Palantir define it as being. So, I'm not kidding. I've done a deep dive on this. They are building systems and credit scores and health scores for doing predictive modeling and for determining who gets what care. United Healthcare and Cigna have been implementing AI recently. United Healthcare is being sued because
they'll put me out to pasture then, is what you're saying.
Well, they'll put a lot of us out to pasture for a whole variety of different reasons. But I'm not exaggerating when I say that they're designing these systems.
I don't think so at all.
Aaron, finish your thought on the United Healthcare. What are they doing?
United Healthcare is using AI, as Cigna and others are, for claims processing now. And they're in a lawsuit where it's alleged that for their Medicare Advantage program, they are denying 90% of claims. And guess what happens when you're denied and you appeal? Your appeal goes to the AI. So this is a situation that's going on right now. And by the way, this is happening now in the speed of 0.2 seconds. That's how long it takes for the AI to spit back the denial. But here's the more worrisome part. And by the way, this is something that I've said that a lot of people are pissed off about, and I don't care because it's 100% true. You can either have MAHA or you can have medical freedom, but you cannot have both. It turns out MAHA is nothing but a platform for pushing a technocratic agenda. It's not even just Kennedy talking about wearables. When you look at what they're doing with this health data behind the scenes, it's utterly horrifying. And to connect the dots here—
Is Kennedy in on it, or is he being duped?
He's absolutely in on it.
Okay.
I'm so sick of the white knight. Look, at this point, by the way, what difference does it make? But
it does make a difference. I would like to think there's someone out there who's not a bad person.
It's not a superhero movie. I'm sorry, Aaron. Let me just. Everybody keeps thinking this is a superhero movie, and I'll say it over and over and over again. I get the messages from people. This is not a football game. It's not the fourth quarter, and these are not the Avengers. Aaron, please. Go ahead.
But that's what everybody thinks. I remember the propaganda about it. Oh, we've got the dream team. We've got Vivek. We've got Tulsi Gabbard. We've got RFK. These people are going to save Western civilization. It was all bullshit. But RFK, here's the problem with RFK. RFK actually thinks it's the role of government to make people healthy. This is the thing that's missing about all this. And by the way, that is not compatible with medical freedom. Medical freedom is I get to decide what I do with my body, not a new group of Avengers comes in and now they've got the right playbook to make everybody healthy. That's why I say you can't have MAHA and medical freedom, because it's an actual approach to how healthcare fundamentally works. I'm seeing nothing medical freedom out of Kennedy or the
so the minute he got into power and he went after Fruit Loops, right? I mean, that was a warning shot right there. The minute he got into power and he starts going after dye colors and stuff like that, that was a warning. I think the pharmaceutical industry is a serious problem. And if he had stayed on the path of saying, look, you guys have to do a better job, the FDA has to, but there are certain things you need to know. I can't evaluate the efficacy and the toxicity of a drug myself. I just can't do it. So there's times where some sort of organization is helpful. There could be a private sector version. So for example, here's the thing. I saw a guy get interviewed the other day about SSRIs. It was a doctor, and he talked about the horror of SSRIs, and I think they're really bad. Someone I know well is on a related drug called Effexor, and you go on Twitter and you search Effexor, and it's nothing but bad news. Nothing but bad news. And I think we do need. I don't think we need to be completely, anarcho-libertarian. I think there's things you can ask government to do. You should minimize it. You should Ron Paul it, if you want to say.
Well, I'll say this. So I'm not engaging these debates. I'm building solutions. We're launching something at the end of this month, which is a worldwide medical tourism marketplace. Our healthcare system is beyond fixing. It turns out you can get medical procedures overseas at 80% the cost with higher healthcare, with better healthcare outcomes. And I'm not talking about
80% is an overestimate. My son broke his foot in Vietnam, got it casted, went to a hospital in Ho Chi Minh City, got an MRI, got pins put in it, was in the hospital for a couple days, $1,200.
Yep. Yeah. No, this website will actually show, and there's these centers in places like Turkey and Thailand and everything else where when you actually see the care that's being delivered, it's like the difference between living in the Jetsons and the Flintstones, which is essentially what we have here. And we're talking about complex heart surgery. We're talking about cancer treatment. We're not talking about just cosmetic procedures. It's now $100 billion a year industry. So we're putting this site together to help promote. There's a place in Mexico called Molar City, where I think that there are something like 500 dentists in a town, or 350 dentists in a town of 5,000 people.
Molar City.
Molar City. And so when the site comes out, I mean, obviously I'll share it, but it's just fascinating what's going on globally with respect to healthcare. So I think that, we need to be taking the approach of we're in charge of our own health, not our doctor, not the government, and truly open this up to market pressure. That's where I'm spending time. But I'm not seeing.
Well, I think that makes sense to me. So if you can find out where the healthcare is good and where it is fairly priced, then that's a real plus. Well, I get that.
Well, also though too, and this is where I was trying to temper people's expectations in regards to Kennedy, because look at how many people in this country are dependent on pharmaceuticals, whether it be antidepressants, Ozempic, Adderall, on and on and on and on and on. And, the pharmaceutical, they're not going to let you, it's a cartel. They're not going to let Kennedy come in and take that money away.
I don't know if you saw this. I shared this picture, and I call it the most American picture of where we are right now. And it's that picture of the press conference where it's RFK's there, Dr. Oz is there, Trump is there, and they're talking about how Medicare is now going to pay for Ozempic. And then the CEO of the company, Novo Nordisk, I believe, has a heart attack. RFK exits the room immediately and bolts. And then Trump is standing there looking like he has his dick in his hands.
I have to take this just a second. You guys go without.
Yeah. That picture to me is the exact summation of everything that's going on right now. And before we hopped on here, there's some HHS has a live interview Q&A going on between RFK and JD Vance. And I just scrolled through some of it, and all I heard was obesity problem and talking about Ozempic. Now, let me ask you something. Before the election, RFK was talking negatively about Ozempic. The idea that we're now using Medicare to pay for Ozempic, and he's on the stage with JD Vance talking about this, is that anyone's understanding of what MAHA was supposed to be about, or what medical freedom was supposed to be about?
Yeah, I mean, you and I are on the same page with all this. I mean, because I didn't have expectations any of this was going to change. And the other thing with that was, Dave, I muted you, so unmute yourself whenever you're ready to go back. Are you good? You there?
Yep.
Oh, okay. But people had the expectations that things were going to change from that, and I kind of lost my train of thought here for a second. But yeah, I didn't see that with any of this.
No, I mean, and again, so then you have a lot of people that were like, okay, well, we need to focus on COVID and the COVID vaccine. And so now it's not mandatory, and now it's, maybe it's off the recommended list, but the United States government pays for 47% of all of the healthcare in the United States at this point. At one point, it was over 50% during the COVID period. So we're still buying these vaccines. And then Trump does the big, whatever it was, $70 billion announcement with Pfizer, and then talks about Trump RX. I mean, what a rug pull.
You bring up a good point. So, and both of you guys chime in on this and tell me what you think. Was the virus, and you know what I'm talking about, but was it a test to see how much people will bend the knee and comply? Because they were able to, all these things, UBI, that was rolled out during that time where they put those $600 deposits in your bank accounts. People just complied. Even if it was unconstitutional and illegal, people just went along with it. And to me, I look at it as it was a big win for them. People will say, no, they pushed back, red states pushed back, fought back, and got things reversed. I think they accomplished exactly what they needed to accomplish, and now they know what they can get away with.
Complete victory. It was a complete victory for the technocrats, and it was just one element of a longer strategy. I mean, look at what happened. Look at the CARES Act and everything that we got from that. I mean, we eliminated the fractional reserve requirement for banking. We added things like contact tracing. It was a massive win across the board for the surveillance state. Now, going back to Palantir, when you dig into this AI, did you know that Palantir was used with the CDC and the NIH in the rollout of Operation Warp Speed? Palantir is already embedded in public health. So normally when people think about Palantir, they think about it in the context of the CIA with respect to military operations.
When did Palantir start? When? What's your knowledge of the beginning of Palantir?
I was a while. I think it was more. Let me see. I think it was more than 8 years ago. Let me see.
So I was just listening to someone I know talk about Palantir and doing military stuff in '96.
Founded in 03. Founded in 03.
03.
Yeah, this guy was talking about how he was in the military. So I was talking to the guy sitting in a bar, and he said our guys were using Palantir software in the military in '96.
Wow, that's news.
Yeah, that was news to me. But I thought, well, maybe everyone but me knows this, so that there's that. There's a question I've been laboring over. Clearly, everything to do with the virus and the vaccine and everything is just a total load of crap. And I'm in the group, which I haven't been to lately because I haven't seen the topics I want to go to, but the Doctors for COVID Ethics, where we just twice a week brought people through, and anyone, lawyers, doctors, NSA guys, you name it. And the question I keep asking is, did they overplay their hand, or did they do it just right? Now, the overplay the hand would be, so for example, if I wanted to do the nefarious things they did, but have us not get mad at them, I would have backed off and said pregnant women don't have to take the vaccine. If you got the antibodies, you don't have to take the vaccine. There were certain things they could have backed off on and not tip their hands so garishly to the populace to figure out that we all got totally screwed. Now, the alternative model is they did that, and they're basically saying there's nothing you can do about it. We're coming. It's like when Larry Bird would tell his defender, "Look, I'm gonna break to the right, do it, pull up jump shot, and you can't stop me." He would trash talk him. What do you think it is?
So I think, because I know a lot of people that are in there now, and they believe in this cult of Bobby, and they think that we're exposing everything that happened with COVID. And so what's actually happened? So now people are trying to go after Fauci as if Fauci was the problem, because it wasn't a systemic problem with public health. But when you look at it, they completely got away with it, because I'm going to go back to Palantir. Palantir was involved with and was given a lot of credit, when you dig into it, for the, quote, success of the efficiency of Operation Warp Speed. So has Palantir grown in stature and influence, or has it receded? No one is even challenging.
That's a rhetorical question, right?
No one's even. Yes. So now they already have the CDC information. They have the information for COVID testing and everything else. And now Trump has authorized them. Now we're marrying this with IRS data and other data. And then Palantir, the level to which Palantir is involved in healthcare. And I'm bringing this up just because I was even surprised by it, and I thought I followed this stuff. Did you know that Palantir has a contract to build out an entire database of all of the people in the NHS in the UK? 330 million pound contract. They're building that out. And now they're down at the level of, they have a program for startups. If you are a wearable company or a healthcare startup company, you can get free access to the Palantir analytics platform in exchange for your de-anonymized data.
Well, I assume they got the DNA of the entire globe.
Yeah, that's exactly what's happening. So, but Palantir's not the enemy, right? I mean, it may be Michael Burry may think it's the enemy, and him putting the downward. Palantir is I hate Palantir, but they're safe in terms of what's going on with these government contracts. They just happen to be the real enemy that we should be focusing our attention on, and we're not. So I think the technocrats won in a phenomenal way that I didn't understand and couldn't have predicted, because right now, as I'll say it again, there is no friction and there is no opposition to the expansion of Technocracy. And then here's another one. People will try to say, well, the WEF lost because Klaus Schwab is gone. Klaus Schwab was replaced by Larry Fink. If you think Larry Fink is less effective at pushing Technocracy than Klaus Schwab, I think you're probably not looking at this properly.
Klaus Schwab was a cartoon character, right? I mean, he really
old.
was.
He's old.
No, but he was. They didn't even try to make him look credible, right? He was a made-for-TV movie character, right? He dressed like he was on Star Trek. He was fake from head to toe.